First of all, I would like we correct our data as Parliament. The school is Mwebaze High School in Kachiri, and it's found in Wakiso district. And also, just to add on, the matter, you hinted on the matter of Malaria SS in where you get it. That also had a suicidal death. Since Mr. Speaker, our Honorable Minister has asked for time, I only pray that as it comes on, as we get that very workshop, he also starts right now to handle the matter of mental health in schools, because it's something they are living out somehow, and it's affecting many of our children. Our children are overloaded, they are reading hard, they are doing a lot. So the Ministry of Health and Education, they have to work together to see that we have those counseling services and the children are handled well. I thank you so much.
Yes, mental health is a serious concern. Honorable Ministers of Health and Education, you will need to formulate. Honorable Minister of Education, you have something? Then General Kavuma, you come and there is a traditional healer here. We shall conclude with. Yeah.
Right Honorable Speaker, first of all, I thank the MP of Wakiso. As a sector of education, we have been issuing circulars and we have communicated to almost all schools in the country. There's one biggest challenge which now goes to us, the parents. And this is where we need your indulgence. Some of us are part and parcel of the problem affecting our children. A case in point is where you go for visitation with a helicopter, particularly you give your kid an helicopter to go to school. I'm speaking as a minister of the sector. Secondly, some of you go, because it's a birthday of your kid, you go and splash money, throwing it before other children. Friends, what happens to others who do not have access to this kind of money? And tomorrow you're the same person who denies that kid the same money, and yet the kid, you've made that kid get used to this money. So I want really to appeal to all of us. We are all stakeholders regarding matters of education. And it is our responsibility to get out and talk to our people, talk to our constituents, to behave in line with the guidelines we have issued. Honorable Speaker, I will be able to lay on table the circular guidelines we have issued at the Ministry of Education and Sports to all districts, schools across the country. Because we did it in the last Parliament, I can again be able to issue it so that we get out. But I welcome the initiative of saying we get out and talk about mental health. But it's our responsibility as members of Parliament. I thank you so much.
General Kavuma, Honorable General Kavuma, give the military precision to this matter.
Thank you very much, Right Honorable Speaker, for giving me this opportunity. But let me, before I make my submission, join those who spoke before me to congratulate you for being a Speaker of the Toronto Parliament. Congratulations. Number two, on the matter, I'm not a doctor, but I'm a reader, I'm a parent, and I have life. Today, the House is debating on malaria. But I don't think it is only malaria that is killing Ugandans. So many, but this one was maybe special because it killed children. And malaria has been killing children, by the way, for a very long time. It is still, I think, the topmost killer disease in Uganda. However, Ugandans, if you do research, even in the region, we lose a lot of people because of quite a number of illnesses and problems. And I've been trying to do some research to find out why in Uganda, speakers, ministers, PSCs, generals, cancer. Why in Uganda? And my research revealed two main issues. Number one, Right Honorable Speaker, is that 98% of Ugandans do not go for periodic and regular medical checkups. That is a fact. we live on self, medication. You get headache, you go to the nearest pharmacy. The pharmacist prescribes some drugs, you go home. When the pain reduces, you don't even finish that drug they gave you. That's why you see every 2 kilometers there is a new pharmacy, because pharmacies make a lot of money out of us, or drug shops. And if you check, for us who are here, if you reflect what is in your bedroom, you find all of us having many pharmacies in our bedrooms and houses because of self-medication. Now, that is a problem to all of us. But number 2, Right Honorable Speaker, is even the 2% that try to find out how they are, to check regularly, do not get the correct diagnosis. That is also another huge problem. If you pick 10 people from this parliament and you send them to the famous hospitals in Kampala here, you go to Murago, they'll take your blood and whatever, they'll give you results. If you go to Nakasero and test for the same, different results. If you go to IHK, they give different results. Now, where is the problem? You have issues, they say it is pneumonia, mild pneumonia. They give you a sack of antibiotics. You finish them, the pain comes back. You go to another hospital, it is ulcers. They give you another sack of antibiotics. You finish them, the pain comes back, you go to another hospital. It is... Now, those, Right Honorable Speaker, those who afford, when they go to our neighbor here in Aga Khan, which takes only 50 minutes from here, they check you, they find you have cancer and it is at stage 4. So my question is, where is it the machines? Where do we buy these machines? Is it the people that read the outcome of the machines? Where is the problem? So my players are, Right Honorable Speaker, my 2 players is, we are leaders, you are here as a house, you represent people. Please go back and sensitize and mobilize your people, the people you lead, the people that elected you to come here, to go for regular and periodic medical checkup. Number 2 player is the Minister of Education should look at the diagnosis issue. Where is the challenge? I beg to submit.
Yes, traditional healer. Honorable Minister, note down, because the Shadow Minister of Health is going to give some statement, and you'll wrap it up. The traditional healer is doing well. Honorable Lino.
Thank you, Right Honorable Speaker. Mine is just a suggestion. In our secondary schools, primary schools, boarding, these schools majorly have sick bays with a nurse, but they do not have laboratory technologists, because most of the time when kids are sick or children are sick, the nurse just assumes. So I want to suggest to Ministry of Education and Health, if they can come up with a policy insisting that schools must recruit a lab technologist, and the schools should buy simple microscope to at least carry out some tests, because diagnosis is the most important thing. It helps you to understand and know what disease a child is suffering from. So I would request the Minister of Education and the Health to come up with a policy so that all our secondary boarding schools have at least simple laboratories. Thank you.
You must take that recommendation from a traditional healer very seriously. Because they have tried to do guesswork, they have seen more people dying. Honorable Aisha. Yes? and then shadow minister, and then the real minister closes.
Thank you so
I don't know who
much.
started the issue of shadow and what. Yeah.
Thank you so much, Mr. Speaker. I want to thank the previous speakers. First of all, I need to clarify that the prevalence is no longer 10%. Those are statistics of 2019. And it has actually increased. And many of these malaria cases are actually in schools, secondary schools, primary schools. And like my colleague has mentioned, the treatment method, that's where the problem is. They give them Panadol, headache Panadol alone. And finally, I also wanted to add that unfortunately, blood group O positive are also very prone to mosquito bites and malaria. Thank you so much.
Shadow Minister of Health.
Thank you, Right Honorable Speaker.
2 minutes. By the way, you are too generous with time. We have the next time that, yeah.
Yes, thank you, Right Honorable Speaker. And I'm making a submission on behalf of Dr. Batua, Honorable Dr. Batua, who is away on official duty, and I stand in for him as Shadow Minister, Health. Right Honorable Speaker, while we appreciate the Minister's report, we must confront this malaria problem with green. Uganda remains trapped in a preventable crisis. Right Honorable Speaker, the Minister speaks, Dr. Beremusi, you speak of progress, but the Uganda Malaria Indicator Survey reveals a terrifying policy failure. The national prevalence has actually risen from 10% to 13%. In regions like Lango, Acholi, Karamoja, childhood infection rates are at a high as 60%. This is not progress. This is a national emergency. As Shadow Minister, we request and demand for an immediate policy reversal from passive malaria control to an aggressive elimination agenda. First, we must stop distribution of the obsolete standard pyrethroid nets that mosquitoes are now laughing at. The government must fully pivot to dual-insecticide next-generation nets like chlorophyra-treated nets, which have been proven by World Health Organization to slash transmission by 50%. Secondly, Honorable Minister, we request to institutionalize a mandatory indoor residual spraying, that is IRS, in public facilities, specifically boarding schools, to protect our children where they are most vulnerable. Finally, Right Honorable Speaker, we cannot eradicate malaria on a beggar's budget. We demand a shift from total dependency on foreign donors to dedicated domestic health financing. We must equip our village health teams and end the chronic fetal medicine stockouts in our health centers, and this is happening to all of us in our areas of jurisdiction. Right Honorable Speaker, we must stop managing malaria and start killing it. I beg to submit.
Thank you. There's somebody here who said he has a 1 minute thing about the vector. Honorable Sia. 1 minute. Or 1 minute.